Laparoscopic trocar placement. Knowledge of anterior abdominal wall anatomy is critical for successful trocar placement in laparoscopic surgery. The anterior abdominal wall consists of the skin, subcutaneous tissue, the anterior fascial sheath, the rectus muscle, and posterior fascial sheath. Laterally, the rectus muscle layer is replaced by external and internal obliques and the transversalis muscle. Of note, the posterior sheath is only found above the arcuate line. Important vasculature of the anterior abdominal wall includes the inferior and superficial epigastric and circumflex iliac vessels. The inferior epigastric artery arises from the external iliac artery near the mid-portion of the inguinal ligament, then courses cephalad and medially along the posterolateral portion of the rectus muscle to a point approximately 4 centimeters lateral to the umbilicus. The superficial epigastrics arise from the femoral arteries and course cephalad medial to the inferior epigastrics. The deep circumflex iliac vessels arise from the external iliac artery, course behind the inguinal ligament, then along the iliac crest. Lateral port placement can jeopardize the ilioinguinal and iliohypogastric nerves, which provide sensory innervation to the groin and suprapubic area, as well as the inferior abdominal wall. The ilioinguinal and iliohypogastric nerves pass 2 to 3 centimeters medial and 1 to 4 centimeters inferior to the anterior superior iliac spine, then course inferomedially towards the midline and pubic symphysis. The umbilicus is the most common site for primary trocar placement, as it is the thinnest site on the anterior abdominal wall.